At Bayscribe, we believe that a comprehensive clinical documentation solution can accelerate reaching meaningful use. In the PricewaterhouseCoopers Health Research Institute paper, Ready or Not, on the Road to the Meaningful Use of EHRs in Health IT, 120 Chime CIOs were interviewed. A full 80% were concerned or very concerned with their facility's ability to meet meaningful use requirements within the specified time frame. Those interviewed cited affecting behavioral change across the organization, vendor readiness, and the availability of skilled IT resources as the main reasons. Another key concern? Capital. Although there are millions of dollars of incentive money on the table, there are indications that the majority of the healthcare market will not be ready. 79% of CIOs cited overall cost, and 71% cited access to capital as a major concern. So even if you have the financial resources and qualified IT resources, what if the physicians don't buy in? What then? In June 2008, the New England Journal of Medicine's online edition published that only 4% of clinicians had adopted a fully functional EHR, and only 13% use a basic EHR, with basic defined as no CPOE or decision support capabilities. Why is that? Outside of cost, a major obstacle is the use of templated documentation methods. Physicians don't want to point and click and sacrifice the clinical narrative that allows them to document the unique story of the patient encounter. And as the AC group documented, a review of 573 charts showed that implementing templated reporting took an average of 9 times longer than dictation, directly impacting physician productivity. The challenge with traditional dictation is the extraction of data. To meet meaningful use criteria, we need to get structured data from the reports. So how do we do that? So the question becomes, how can you improve physician adoption and provide the opportunity to meet meaningful use? The best chance for success is to minimize the disruption to the physician's preferred workflow, which most likely includes dictation. With Bayscribe, physicians can dictate into a variety of devices, including Android and iPhone, with integrated patient lists provided directly from your patient registration system, including date and time of service. Give the physicians better tools to do their job the way they prefer to do it, and in return get structured codified data into the EHR to maximize reimbursement. So what are the potential impacts of this? Financially, a typical 500-bed hospital demonstrating meaningful use by 2011 could receive more than $6 million in Medicare incentive payments, and individual physicians could receive up to $44,000 over 5 years, according to PricewaterhouseCoopers. Yet only half of the Chime hospital CIOs surveyed said they would be ready to apply for those incentives in 2011. Bayscribe provides solutions for facilities of all sizes, from less than 5 doctors to more than 500 beds to an entire health system. There's a Bayscribe solution that is right for you. A solution that will help you gather structured data and share it across the enterprise with your RIO or HIE and across the nation without having to invest major capital, if any. So what are you waiting for? The future of clinical documentation is here today with Bayscribe. Please take a few minutes to explore our site and see how we may be able to help you get your meaningful use dollars and have your physicians be happy about it.